Hi, everyone. It's Men's Health Month, and I'm going to speak about another issue that affects many males, which is male pattern hair loss. So, you know, it plagues many people, and it's so disconcerting when it happens. So, what can you do to slow it down? What can you do to reverse it and prevent it? So, it is pretty much mostly a hormonal driven issue. Um, we happen to have on our hair follicles receptors for dihydrotestosterone, and men have high levels of testosterone in their bodies, and that can be converted into dihydrotestosterone, which will bind to those receptors on the hair follicle and can lead to hair loss or thinning, or even where there's like a change in the diameter of the hair shaft. So it's like the thick hairs tend to fall out and are replaced by finer, wispier hairs until those can also fall out, and then a person can lose, become bald in a certain area. So a good strategy in the beginning, if you see this starting to happen, is to work with natural agents to reduce the conversion of testosterone to dihydrotestosterone. So one natural agent that does that is saw palmetto, and it actually works very well. So if it's a more advanced issue, some men take pharmaceuticals for this. Propecia is a drug that does the exact same thing as saw palmetto, but it's just stronger. And so again, this is a 5-alpha reductase inhibitor, reducing the conversion of testosterone to dihydrotestosterone. So if you reduce the conversion, you're going to have less DHT binding to the receptors on the hair follicles. So if you now, let's say you've gotten on those and you want to try to grow the hair back. Well, topical minoxidil actually has some good data behind it. And what is that? So minoxidil was a vasodilator that people used to take orally for controlling blood pressure. And then it was noticed that oftentimes when people took minoxidil, they would sprout bushier eyebrows, and hair growth would grow not only on the head, but like even would become more abundant on the chest or the arms or whatever. So that really fell out of favor as an oral blood pressure medication, but then started to be capitalized on topically on the head. So if you apply it to the head, it's going to dilate the blood vessels that supply blood to the hair follicle, so that you're going to get more nutrient delivery there. And that helps the hair grow back and grow back thicker and have like larger diameter strands. So I'm actually a big fan of topical minoxidil, if provided you've gotten to the root of why it's falling out in the first place and you have corrected that. So then, aside from this being the most common cause of hair loss in men, you also need to think of some of the other causes, which would be iron deficiency, thyroid deficiency, thyroid excess, even gluten allergy, and other types of autoimmune related hair loss, which look very different than your typical male pattern hair loss, which tends to be temple and crown primarily, but the autoimmune hair loss is usually in discrete patches and can happen anywhere on the head. And then finally, if let's say you're controlled for the underlying factors, you've been on topical minoxidil and only gotten so much benefit out of that, is there anything else you can do? Yes, you could consider doing some PRP injections into the scalp. It doesn't work every time, but for many people, it does work. So you might consider going to an aesthetic center and seeing a dermatologist who specializes in hair loss and having your own blood plasma kind of injected back into the scalp because it contains growth factors that could revitalize kind of like a ailing hair follicle. So, all right, I hope that helps.